So, South Korea plans to lower its COVID-19's risk rating to the lowest level, Class 4, on the infectious diseases risk classification scale as a part of its three-step endemic roadmap. For more, we're joined by Dr. David Kwak this morning. It's great to have you back.
Good morning. Thanks for having me.
So right now, COVID-19 is ranked Class 2, which is the second highest rating alongside other high-risk diseases like cholera. Now, what does it mean to have the virus rating lowered from Class 2 to 4?
Well, the biggest difference there would be is that from classes 1 to 3, the doctors are mandated to report to the government so that the government can actually have a keen eyes on how many cases each infectious diseases bring about. But when it goes down to classification 4, the doctors are no longer mandated to report it. It's just that the government still needs to keep an observance of how many cases these diseases that belong to class 4 will bring about, except it's not expected to cause, let's say, dire consequences, such as many cases of deaths. So those illnesses that belong to classification 4, it's rather relaxed in regards to the government's monitoring.
Sure, you still do have to stay vigilant, but there are definitely less mandatory tasks for both doctors and patients, right?
That's correct.
Then there'll be an advisory committee meeting before the Korea Disease Control and Prevention Agency implements this decision, possibly as early as next week. Then how likely is it that the risk rating will be lowered to the lowest level? I mean, any variables that will make the process a bit more complicated?
Well, this is just my personal opinion, but obviously the biggest variable that will factor into the decision making is the current peak we're observing. Even though it's not as high as what we've experienced in the last winter, but what I believe is that many people nowadays are not actually being tested for COVID-19 despite being suspected of having it. So the number currently we're seeing is not completely reflective of the total numbers that should be counted for. So considering that factor, I think we have to still go through this peak once again and observe whether or not it will create more severe cases. And if that is so, I think the decision making to bring down the classification level will be sort of delayed. But if in case this peak does not create as much of the severe cases and it goes as expected to be just like any other common cold symptoms, or even in more serious cases just like influenza, then they might possibly make the decision to actually lower. But I don't think it's likely that they will bring it down this month because we're still going through the yet another peak at this moment.
Right, exactly. I have a handful list of people who have been infected recently. Then the question is, why is it that the virus is going around a lot more frequently or often in the past few weeks? Is it the new variants, eased the virus rules, and should we expect a resurgence of the virus? Or are we there already?
Well, obviously, there will be multiples of different factors that are causing the peak that we're going through. I don't think it's necessarily a new variant that we are experiencing. The most common variants that are sort of detected is XBB.1.9.2 at this moment within our country, but that's yet another subvariant of Omicron variant, so it's not something completely new. But obviously, social factors, a lot of people nowadays are sort of mingling much more together and actually going to these different traveling sites and then socializing a lot more, sort of in a compensation way that for what they have lost in the past year or so due to strict social distancing guidelines. But there would also possibly be another factor from possibly waning of immunity against COVID-19 that we receive from either prior infections or having from vaccinations. So I think it is quite possible that a lot of medical sectors would now start to think about possibly implementing or tertiary or fourth vaccination program as well.
Sure. Another new guideline on the way is possibly there's speculation that the downgrade could lift the remaining mask mandates for medical facilities and other vulnerable inpatient locations, right? Now, do you think that's possible or even a good idea? I mean, are we ready for a life completely without masks?
Well, this is yet again another just personal opinion of mine, is that lifting the mandates for the mask has already been partially taken, and we're observing in the streets that people who wants to be rather more strictly protected, they are still wearing their masks. So I guess in a sense that lifting the mandates or giving a new guidance to actually giving people the freedom to not wear their mask if they feel free to do so, would be okay in a sense that people are still choosing to. So in this, yet again, this time of peak that we're going through, we're observing a lot of people who has to go inside in an enclosed spaces such as hospitals, well, not hospitals because they're mandated, but let's say subways or public spaces. A lot of people who are rather more elderly or people who are much younger, they are choosing to actually still wear the mask. So even if the government was to make the decision to actually lower the classification and lift up the mandates for people wearing the mask, I think it will be okay because people now have the conscience to actually choose to wear the mask.
Sure. Thank you so much for your insight this morning. You have a good day.
You too. Thank you.